our guest speaker tonight, Mr. Dr. Jim Hines, running for governor, accepted our invitation to come up and speak to us. So we've had a good handle on getting people elected that have started here.
Oh, great.
Yeah, I tell you what, that's true.
Thank you, Jim.
Thank you. It's so good to be here, and thank you, Larry and Pastor, for praying, and for all those that are here. Tom, that was great, your discussion, and Judge, nice to have you here. As I thought about what to talk about, I think the first thing to speak about is who I am. Kind of an introduction, and then we'll have a Q&A, and I think I'm on schedule for maybe 20 minutes or so. So I'm Dr. Jim Hines. I'm a physician. I've delivered thousands of babies. I've never served in politics at all. I've never I've never been in politics. I'm an outsider. I'm a complete outsider. I'm an OBGYN, and I come from Saginaw, Michigan, and I have put people first for the last 37 years. If we go back a little bit, I grew up in a small town in Indiana with 3 lakes. When it was summertime, I spent summer on the farm with both of my grandparents. I was left there by my family, and my grandpas, they just kind of let me run around. They gave me things to do, and so that was growing up. My first 2 jobs were as a paper boy and a dishwasher. And as I was a dishwasher, we hired a young lady at that place, and that happened to be my wife, Martha. So I met her when I was very young, and moved up to the assistant manager of the pizza place. We got married, went to Indiana University, and I graduated from IU with a double major, chemistry and biology. I was then accepted to Indiana University School of Medicine, and the last 2 years were spent as the curators, primarily in the evening and on the weekends, of the President Benjamin Harrison home, who was our 25th president of the United States. And I remember representatives and senators coming through. Governor Otis Bowen came through the Benjamin Harrison home, and I had the privilege of giving him a tour. Following my training, we went to Africa, and we lived in the Central African Republic for 4 years, where I ran 2 hospitals and 20 urgent care facilities, taking care of about 1.5 million people. It was exciting. It was during the HIV epidemic. We had insurgents from Chad that came in to kill and destroy and do all kinds of bad things. And as a medical team, we chose to stay in the Central African Republic, because if we left, there would be a lot more casualties. And so I became a trauma surgeon. So I started off as an OBGYN, and so for a year I was a trauma surgeon, doing amputations, taking out bullets and grenade parts. And it was like I was in the military, even though I was not in the military, and have 2 brothers that are veterans, both of the Navy. We came back to the United States, and I led 24 medical teams all over the world, teaching and giving medical care to individuals in Vietnam, Chad, a number of other countries in Africa, Cambodia, Romania. I've been to Central America, South America, and felt that was a very fulfilling type of work. I started in a practice in Saginaw, which grew to the point where I became one of the owners, then the president of Valley OBGYN, and then got involved with administration of the hospital. So I'm the past chief of staff of Coventry Healthcare. I'm the past president of the Christian Medical and Dental Association, which is a professional organization of doctors and dentists, about 18,000 of them here in the United States. I was on MSU's staff, Michigan State University staff, for about 17 years, and currently I'm an associate clinical professor at Central Michigan University. And so this has been going on in my life, and in March of 2015 I was in Philadelphia. Several of you have already asked, well, why did you go into politics, you know? And I think that you deserve an answer to know that I was in Philadelphia attending a medical conference and had some time, and so I read something that Thomas Jefferson had written in 1779, where he said the greatest threat to America would be when the best qualified people refused to run for political office because it was too hard, too arduous, or too time-consuming. And God used that to shift my focus from an international focus and a national focus to really thinking and looking at what's going on here in Michigan. I have two brothers that are veterans in the Navy, and they said, Jim, you know, freedom, we all know this, freedom was not free. It cost. It cost a lot. It cost the lives of so many people. And we have to defend the freedoms and the liberties that we have. And I think that's what I've heard already tonight. I see a desire to live free under our Constitution, and you're passionate about it. And I became passionate about it also. And so here I am. I'm running for governor of the state of Michigan. My wife and I have been married for 42 years. We have 7 sons and 13 grandchildren. I'm pro-life, pro-Second Amendment all the way. I'm pro-choice in education. I'm for small government, limited government. I'm for decreasing our taxes and letting us do what we want to do within the rule of law here in Michigan. I think it's very, very important. I want to put people first and not politics. So often politics, the political aspect of our government is put before the needs of people. Politicians tend to promise a lot and deliver so little. I'm not saying about that in anybody here, but you know what I'm talking about. We put politics first and then people. And for 37 years as a physician, I've been putting people first in my practice. And so it's natural for me to be concerned and aggravated and upset when I see in Lansing and in our federal government where politicians are promising things and putting themselves and their interests, the bureaucracy of things first and not people. And it was Ronald Reagan who said that putting people first, use that same term, putting people first is America's secret weapon. Well, how so? Because when you put people first, you are enabling them, you're spurring them on to dream and to dare and to take great risks for the greater good of the people, of their community, of their state, of the country. And when you lose putting people first, then you get this selfishness. And so what we're seeing, and I appreciate the town hall meetings and the disruptions, but what people are tending to do is they're putting their agenda first, their personal feelings first, but it's really, they're not thinking of the other guy. These are your neighbors, people that go to church with you, and they, in a sense, are becoming your enemies over what's happening in our country, and it shouldn't be that way. We should all put people first, and politics needs to fall way, 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 way back. So that's really the introduction that I wanted to give. I don't think that when the election comes in 15 months in the primary that you all are going to be interested in someone with a long political resume. You should be interested in someone who wants to put people first, is going to look after the people and make a big difference. And that's exactly what I want to do. Are there any questions? Yes, ma'am.
I'd like to know your stance on immigration and refugees.
Okay. Well, illegal immigrants are individuals that have snuck into the country or overstayed their visa. And those especially that are crossing the border, not being vetted, it's hard to tell why they're coming. They may be ISIS people, they may be other people that want to hurt us, and there are plenty of examples of that happening. And so I'm for secure borders, I'm not for open borders. I think we have a country, and if we're going to have a country, then we need to have secure borders. And that means that people that want to come in, they need to come in legally. Those that are here illegally, that have broken the law, they need to be sent back. There's a lot of discussion, well, what do you do with someone who came here illegally or overstayed their visa and now they're here illegally? That's a hard thing. I have a lot of patients that are immigrants. I don't know of any that are illegal immigrants, but you know, I know that there are kids involved and extended families, and so that's a difficult problem. But I don't think anybody that's here illegally that breaks the law should stay. They need to go back and come the legal way. As far as refugees go, I think they need to be vetted. You know, I can't see it any other way. You cannot have people coming to our country from areas where the leadership has sworn that they want to wipe America off the map. You just can't, because what's happening is you're risking the lives of not only yourselves, but your grandchildren and the future progeny.
But a lot of these groups come over and the states are forced to take certain numbers of refugees. And these people set up their own little country, like it was back home. And if you want to come to our country and join in our culture and learn our language and become citizens, then I'm kind of for that. But if you want to set up, your own little Shia town, go home.
Dearborn.
If you want to set up, little Mexico, go home.
I would agree that they need to integrate. That means learning history, English, and if they want to become a citizen, then they have to show proficiency in that.
I think it should be required that they become a citizen. I don't think, can you think of a reason?
I think they should be on the path to become a citizen. What's happening in Europe with France and Belgium, you're right, you have a lot of refugees coming in and they just set up their little country in another country, and then pretty soon that country does not have its identity. So it's a big issue.
Yes.
Would
I think
you refute?
security is extremely important for us,
Yes.
for Americans. Yes, sir.
Okay, you said people first, not politics. How are you gonna do it? What's your policy? Have you got this all nailed down? Is
I
this
think
concrete?
that in every agency and department, very good question, we need to put people first. And that means actually looking at what you're doing and making sure that it is putting people first. It's not just listening to the bureaucrats, not just listening to those who have been in the system a long time. I think my business background will be very, very beneficial. In medicine, we have lobbyists also. And that is drug reps that come into our offices and they want to peddle their particular drug and convinces that it's better than the other three. Well, that's hogwash. It's just hogwash. And so when a politician is purchased by bureaucrats and lobbyists by donations and so forth, this is a big problem, because the individual running for office, their vision and sense is colored because they've received sometimes very large donations from an organization that causes them to vote that way. And they're not representing the people, they're representing themselves or that company, not the people. And it won't be easy, but it has to change. I think Trump is really fighting this in big ways. I mean, he's been obstructed in every way by those who have an agenda. And I believe that he is trying as best as he can to put people first. And when we put people first, that allows our country to flourish. Yes, ma'am.
Can you tell me what your thoughts are on the Affordable Care Act and the direction that it's going right now?
Well, I think the Affordable Care Act is going to go away. What's happened is it's been so costly, and it hasn't done what it was supposed to do. It hasn't put patients back into the doctor's office. It hasn't allowed patients to keep their doctor. Patients are still going to the emergency rooms. What I see in my practice is I see individuals with Healthy Michigan, for example, but they have such high deductibles. When it's time for surgery, they can't pay their deductible. They can't afford $10. And so they still go to the emergency rooms, and physicians there, because they're complaining of headaches and back pain, they do MRI scans and CAT scans, which cost a tremendous amount of money. And so part of that is going to involve tort reform, so that physicians can practice medicine without without worrying about being sued. Because I have had many patients come in and say, now doctor, I know you say I don't need that CAT scan or that ultrasound. If you're wrong, I'm going to sue you. Well, what's the doctor going to do? Nobody likes to be taken to court.
Yeah, actually, can you just tell me a little bit about when the election will be, how many candidates are running, when there's a cutoff for, have you registered? In other words, you're the first person I've met, other than Brian Calley, who I understand is thinking about it, but I don't know what he's done beyond that. But you would know something about the competition.
So I'm the first to announce on the Republican side, And we're in the process of collecting signatures. The primary is in August of 2018. Possibly Brian Kelly will announce May 30th. So the lieutenant governor will be, I'm pretty sure, will be in the race. Bill Schuette, the attorney general, who hasn't announced, and I don't know his schedule, so there'll be at least us three. Pat Colbeck, perhaps, I don't know. So right now, that on the Republican side, that would be those that have announced. I think you have until April to, announce, and I'm not sure what the deadline is for collecting signatures.
Well, those two, Bill Schuette and Brian Kelly, I know both of them are pretty well known. Have you a plan that you think you can give them a good run? As, basically Trump did, he did a magnificent job against people that were better known than he was in a way.
It is going to be very tough, because they're both so well known. Bill Schuette has been campaigning to be the governor for a long time,
Right,
okay? Long time.
right,
Everybody knows him.
right.
But I don't sense, as I travel around and speak, that the people of Michigan, they're not looking for someone with a long resume. So I think that's good, because I'm an outsider. So I'm speaking to as many people as I can, individuals, small groups, large groups. I do 5K runs, we're doing meet and greets. I've been on TV a number of times, radio, and that will markedly pick up when we get closer.
We might rather have a doctor than a lawyer.
No, I think so too. Absolutely. But, we'll see. It's gonna be tough. Now, that brings up a good point, because I need everybody's help. If you think that Dr. Hines would be a great governor for Michigan, I need your help. I need you putting out signs. I need you telling your friends and your family and your neighbors, hey, check out Dr. Jim Hines. I am on the web, which is hines4michigan.com, Hines, the number 4, michigan.com. We put out a newsletter every week that tells you where we are and what we're doing. We send that to everybody, whether they're a Democrat or Republican, which could be problematic in the future. My wife, she'll kind of hand out something if you would like to sign up for the newsletter. It's pretty innocuous. At the bottom it says unsubmit. So if you decide, I don't want to hear any more about this guy, you just hit unsubmit and you'll be taken off. But it does include what we're doing. It includes a blog every week, so it talks in more detail about family. So I haven't said anything about family. Family, the breakdown of the family is unbelievable. And it's part of the problem. What can we do to help families stay together and stick together?
Jim, got a question.
Yes, ma'am.
Would you address term limits and part-time or full-time legislators?
Term limits on the surface, I think, are good. However, what's happened with the term limits is we have, when you come in as a new representative or senator, you really don't know what's going on. And if everybody's new, who's going to mentor you? Who's going to know the policies? And so that's part of the problem of term limits.
Absolutely.
So maybe not having limits that are too long, but in a different manner might be helpful. Stagger them. So when you come in, you don't even know what Act 51 is. You don't know anything. You don't know what the whip is. And so having mentors and some history when you start in our legislature, I think would be very helpful. Your second question was?
Part-time legislature.
Part-time legislature. What I sense happening is I sense times when nobody seems to have much to do, and so they're proposing new laws and new regulations. And so that bothers me. Full-time legislature is in session about 92 times a year. Part-time, we're talking 60. There's a salary difference, but how much time do you actually need to get the work done? The shorter or the less frequent the sessions, the more the executive branch will have to make decisions. And so if the executive branch is a Republican governor, that's great. okay? But if the governor is a Democrat, then having a very short term for our Congress maybe is not as good. So I would support a part-time legislature, but I think it has to be defined and looked at, and if you're doing it because of cost, then you have to look at what we're spending on the staff that work with each one, and so forth.
Dave? Davion?
Yes.
First, I want to apologize to everyone for being late. I'm the treasurer of this organization.
We wondered when you were gonna get there.
I just want to make a comment where we're talking about illegal people in this country. I was listening to Rush Limbaugh, I hope everybody listens to him, one day, and he had a young lady call in, and this was maybe 3-4 years ago. And she came to this country with her parents who came in illegally at the age of 6, okay? In those years from that time, she went to school in America, she went to college in America, she was getting ready to take her exams to become a CPA. Someone like that, we should just, hands down, you're okay, but we do have to vet these illegals as well. Because some people we want to keep that young lady, I think we want badly. Unfortunately, maybe our parents would have to be set back or what, but as I say, it's really a tough decision.
Some of our greatest entrepreneurs are immigrants,
Right, oh yes,
refugees.
yes.
They're smart. You know, they study hard, they have good work ethics. So I think being discriminatory is good. So I don't disagree.
Just a comment.
Yes, sir.
I got a question. Could you define what you think the Department of Health's role should be?
Department of
Health?
Michigan Department of Human
and
Health.
Health
Human
Services.
Services.
Yes.
One thing I noticed that the governor has been doing a lot of work groups, and there's a proposal out there on what that department should be like. They're also doing another work group about how to blend people who get Medicare and Medicaid services, especially to address those who may have physical disabilities as well as mental health.
I guess to make it simple, what do you think the role of the Department of Health should be in Michigan? Because I can tell you how it's expanding.
Yeah, I think it's important, I mean, when we look at the welfare system, it's not for able-bodied people. It may be, maybe you have an able-bodied person that's out of work temporarily, and they need help getting back. But it's really for those elderly, disabled, women who are pregnant, women with small children, because they can't work. And so I think we have to be careful that we don't extend welfare benefits to those who are able to work. We want to push people to work. And I think that is one of the biggest issues. I don't know if that's touching on what you're thinking.
Well, no, what's going on with the Department of Health? They're getting involved in home care. They're getting involved with Girls on the Run. Matter of fact, it's coming to Alcona County
Okay.
in the next month. We buy land to put up bike trails. And I mean, I could go on
Health and
and
Human
on.
Services does that?
Yeah.
Yeah, well, our question is, what do you think the
Yeah.
role of Department of Health
Should
should be?
be.
We're seeing.
Well, okay, so it should provide, it should supervise healthcare as it's given here, that's one of them, here in Michigan, to make sure that Surgicares and health organizations are providing the service that they say they're doing, are supposed to be doing, with the environment that's supposed to be there to deliver that care. So, sterile technique, using correct instruments, and making sure that people are certified doing the things that they're supposed to do. So that's one of the things I think they're supposed to do. Second would be, yes, sir?
I have a question. How many people have been starting to run for your?
Well, let's
And-
have him finish with.
Yes, let me finish this question here.
Oh, I was probably so busy.
He probably knows more about this than I do.
Well, what I wanted to know is if you know about the Muslim that's walking the streets down in Detroit.
Yes. let me get to that question here in a minute. Because we have someone running for governor that's Islamic, that wants to make Michigan a sanctuary state. So, Health and Human Services, so,
Not to interrupt you, I think their question relates to local health departments.
okay,
There are multi-county health departments, and it doesn't relate to the Department of Health and Human Services.
okay,
They're controlled by a whole bunch of very interesting bylaws, guidelines, if you will. And I've talked to Gary on a couple occasions. He comes in and talks to me and says, you know what? You know how much money they're spending on Girls on the Run? I said, I have no idea what Girls on the Run are, and you probably don't either.
well, go ahead.
I just wanted to clarify what he's talking about might be a little bit different than you're thinking.
Right, when you refer to Girls on the Run, I was thinking of women, women.
This is 8 to 13-year-old girls that they're promoting to run. This is, well, just a second. You've got that, okay?
Well,
You've got them
run.
building bike trails in northern Michigan.
You mean to run?
Yeah.
Yeah,
Oh, okay, sorry.
30 hours.
Okay.
A special training.
I'm thinking of Girls
Runaways.
Runaways,
Yeah.
right, I'm thinking of Runaways.
But I was thinking
No,
too.
we're, what we're finding out, what is the role, when we look at what the history of the role of the Department of Health is to be.
And it seems to be quite expansive, so my question is what do you think the limit should be?
What is the role of the Department of Health?
Okay, I would have to do some research on that, because to me, as the name says, Health and Human Services, to provide for citizens that can't provide for themselves. So, welfare-type patients that need health care, making sure that they're getting health care, not providing for, but there are groups of women out there that can't provide for themselves health-wise. So that would be, pap smears, cancer screenings, STD testing, those types of things are happening and are important.
That's another question. When we're talking about what the role of government is, and when you look at the history, but there is a lot of, and I am on your email, and there's stuff I could ask about, but there are a lot of things that the governor has proposed and are going on. And because my husband is a county commissioner, and I'm in healthcare, I do orthopedic rehab, I'm finding the trends out. And to the point at what do we do that's gonna really take money from somebody else to give to somebody else? And where's the role of government? Because every time government provides something, it's taking from somebody else to give. And so when we're looking at what the governor has been working on and some things that are out there, we can talk to you a little bit about it so we can get a heads up. Because I do enjoy receiving your emails, but I only get what you do in activity. I'm not clear on what your positions are and what you're going to do to govern in the various areas that the governor is involved with that will impact on what we do as citizens.
Yes.
I don't really get a sense of that.
Yes, we've changed our newsletters so that now the blog comes with the newsletter. So there's a library of blogs that talk about First Amendment, Second Amendment, raising your family, family devotions, how to keep your family together. So I'm really big on families. So you can find those by just clicking on the blog. Either on Facebook, there's a blog button, or the regular website, there's a blog button. You just hit that and it will have the blogs. But yes, as we go along, we're becoming more and more specific on the areas. This is an area that I haven't researched. But the general idea is that the more we can kick the federal government out of things and handle the issues locally in our counties and communities, the better, because we know our people. And we know what we need, and we know who's messing up and not doing what they're supposed to be doing, and we know who's faking an illness when they should be working. So you know that kind of stuff. So the more we can do locally and other things in the state, the better. And the more we can kick the federal government out of things, the better off we'll be. The more regulations that we can get out of the way, the more growth we're going to see in our businesses. the less restrictions we're gonna have.
Mine's real quick.
Okay,
Okay, first of all, amen, I'm 100% with you, local control. We talked about families, thumbs up or thumbs down, parents get to choose vaccinations for their children. We are not gonna be
no,
forced.
that's the parents should choose whether
Right.
the kids are vaccinated or not.
Right, the
Absolutely.
government's not gonna come in and force us to poison our children.
Well, they might try.
Okay, but you're not for
No,
that.
absolutely not.
Okay, see, quick question, we can go on to the next person.
Okay?
I think Bill had something yet.
Bill
No, that was
Sanders,
good.
Bill asked about, the Muslim who's running
Yes.
Democrat.
Yes. Um,
Yeah.
We can't discriminate against anybody's religion that's running for office. There is a physician who is well-trained, articulate, who is running on the Democrat ticket for governor. He's an outsider, he's never been in political office before, and he might just win the Democrat side. Okay, in the primary. He might,
I hope that's the only way.
Based on affirmative action.
yeah.
He's a
Okay.
physician also, isn't he?
And he's a physician.
Yes.
So, as a physician, automatically on everybody's radar screen, you're thought of more highly. 80, 90% positivity rate. Politician, less than 10%. So being a politician running for any office is not necessarily a good thing. Being a physician, you're caring that, you know, that you care for people and you want the very best for the community. So that, you know, so whether he will actually get the nomination on the Democrat side, I don't know.
Judy has a question for
Yes.
you.
I was going to ask, what do you think is the most pressing issue in Michigan?
I think jobs and education. I think we've made progress under Snyder. We want to continue that progress. We don't want to go backwards. If we elect a Democratic governor, we will go backwards. Gretchen Whitmer, for example, she's promised more regulations, more taxes. She herself would say, people first, not politics. That's what she'll say. She will say that. But the way she says people first, not politics, the government will take care of the people. Okay, that's what she means. The government will take care of the people. That means more taxes, more regulations, and those who have money will be sharing it with those who don't.
What would be your solution?
Decrease regulations, have them under control, balance, you know, what regulations do we really need? I like some have proposed, you know, you want a new regulation, let's get rid of two. We're being regulated out the wazoo. We need to get rid of as many regulations as we can, and we need to decrease taxes where we can. And that involves looking at each line item. And I think, you know, our legislature this time around, they have found $200-300 million that could be deleted from the budget. That's great. Every department needs to do that here in the state of Michigan. What can we get rid of? What don't we need? And that's difficult because when you decrease the amount of money your department gets, that means you may have to let some people go, and that's hard. It's always hard to decrease your budget. If you're in a family, I mean, none of us can live with an unbalanced budget. We have to have a balanced budget. Why should the government not have a balanced budget? And that's going to require cuts. And I think Trump has talked about that, and everybody's moaning and groaning because, you know, we have to cut 5% here or 10% there. But that needs to be done. Yes?
Where are you on the Great Lakes Restoration Project and also on the preservation of the Great Lakes?
The Great Lakes are precious. You know, and I see Michigan as the guardians of the Great Lakes. And not one particular Great Lake, but, you know, we have 4 that border our great state. And so that involves looking at invasive species, that involves agricultural rundown that gets into our rivers and then to our lakes, sewage that's piped into the Great Lakes because of sewage issues, oil, you know, running through our Great Lakes and pipes, that has to be looked at. Anything that would threaten them needs to be looked at carefully, and we need to try to preserve what we have. Yes, sir.
What are your thoughts on the opioid addiction problem that our state and country is facing? And also medical marijuana?
I think the opioid problem is largely caused by physicians giving patients too much pain medication. So I think physicians are not innocent, and I believe that the majority of them know that they're partly responsible in that they might give 100 Vicodin when the patient really only needs 5 or 10. So physicians are somewhat guilty, they're part of the problem. Medical marijuana, no, just regular legalizing marijuana, I'm against it. I'm not particularly fond of medical marijuana either. And the reason is because it really hasn't been studied. It's a drug. The FDA has not approved it. We don't know how it interacts with your medication. So if you're on blood pressure medicine or diabetic medication and you're using marijuana, we don't know what the effect is. Does it increase or decrease the drug levels of the medicines that you're taking? Heaven forbid that you be driving a car high on marijuana. You're going to kill people. We don't know the effect on babies. I have moms that come in, they have nausea of pregnancy, and they say, well, the only thing that takes the nausea away is marijuana. I said, well, why didn't you come and ask me? Because there is medication for the nausea of pregnancy. So I think marijuana is dangerous all the way through. Whether it leads to other drug addiction, there's a lot of debate on that. I personally believe that it does, but it's dangerous. Because it hasn't been tested, we don't know. We know a lot of the bad effects. I can tell you, it's not good.
I can concur.
Okay. Yes, ma'am.
The treasurer concurs.
The FDA is not the end all be all.
40 years.
No,
I
no.
would not rely on them
No.
to clip my toenails.
No, but they haven't even looked at it.
You're right, and they should be looking at half the stuff they are looking
There
at
would be
because they haven't bought
there would be
off.
some researchers that would do research.
Yes, I agree,
But
research.
there aren't.
But the FDA has been bought off, so I would just stay away from the FDA. They're slimy, scummy.
Yes, ma'am.
Two things. Lobbyists and a zero balance budget. Would you kick the lobbyists out and would you start off with a zero balance budget?
I would kick the lobbyists out. Now, what's happening though is, as we talked about earlier, you have brand new freshmen senators and representatives, they don't know how things function. And so the lobbyists, they have stepped into that void. And they're giving instruction and helping. And so,
Yeah, but it's biased instruction.
Oh, yeah, but
Yeah.
that's the problem. When you have part-time legislature or term limits, you're letting the bureaucrats and lobbyists run the government.
You need to differentiate between paid lobbyists and unpaid lobbyists also. Because anytime we talk to our congressmen, we are lobbying.
Technically.
So you
yes,
differentiate.
yes. But, okay, so let's say we had the question about part-time legislature. So that means they're also gonna make less money, and they have to have a second job to take care of their family. So that may backfire and increase the number of lobbyists and bureaucrats who actually are serving in the legislature. So I think that has to be looked at too. The zero balance budget, explain a little bit more what your question is.
Would you be for it, essentially, starting from scratch? This is how much we get in taxes to go into our general fund. This is where we spend it. Just line item one by one, start it from zero, build it back up.
So that would be like forensic counting of the budget.
I'll give you an example. When, and this is especially true in federal government, when they say that they've cut the budget on something, essentially they've taken last year's figures and added on a number less than what was added on to it last year. So yeah, it's a budget cut in that we're not spending as much as we spent last year, but we're starting from a level that's high already.
Right.
As opposed to taking it down to zero and saying, okay, this is how much money we have to work with. Are we going to come in under budget? That would be a zero balance budget starting from.
So I think Trump is trying to do that now. And he is being fought.
Oh, yeah.
Oh my goodness. Nobody wants to hear it.
Uh-huh.
If you have your area, you want those funds.
Oh,
You
yeah.
don't care about anybody else, but you want your money, and that's how everybody is looking at it. And so we do need to balance the budget, and we need to be very clear that when we're proposing less for a certain problem or a certain issue, that it's not taking it back to how it used to be, it's just decreasing the amount of increase from the prior year,
Right.
okay?
Well, the other part of that is, you know, they keep talking about the budget, what they really need to be looking at is the combined accounting and financial records, which shows exactly how much money each of these departments actually already has stuffed in their funding, you know? They've got they got piles and piles of money already stowed for that rainy day. And in my view, that's all that money should go right back in the general fund and say, thank you very much. And now we can get some real honest tax cuts and stuff. But as long as they say, well, we need a budget, everybody thinks about the budget, and that, well, they've already got all this money.
If you were governor, would you push for the legislators to do something like that, to start out and look at their department and say, hey, if you had this much money to work with, where would you make your cuts?
So I
Make
would-
them do it.
I would support forensic analysis, line by line, bills, receipts coming in to actually look and see where the money is being spent, and is it honestly being spent, and who's influencing the spending of the money. And that is the only way you're gonna really get a good grip on what's going on.
I think there's not much of a grip on
So,
what's going
so
on.
that involves decreasing spending, obviously, as we build our tax base by encouraging businesses to grow. You know, that's gonna bring in income to meet the services that we need. I don't think that the Michigan is really gonna grow by bringing others from other states here. It's gonna grow within. Our businesses our manufacturing and businesses are gonna grow and expand. And historically, that's how the economy has grown here in Michigan, is by people that live here already. And, you know, we hope to attract people to Michigan. I would like to retain people in Michigan. My fourth son, Titus, he couldn't get a full-time job, and so he ended up getting one in Florida. So he and his family are in Florida, working full-time with benefits, but we lost him to Florida. Our college graduates are graduating, they're not sticking around. That means your children, they're leaving. 5 of our sons don't even live here in Michigan. They live in other states with our grandchildren. I want them to live here. You know, so I want to make Michigan as attractive as possible. It's a beautiful state. I mean, just driving from Saginaw, where I work, to here is just gorgeous. Just gorgeous. Yes, sir.
About, in Saginaw area, there's over 11,000 jobs that nobody is taking.
Yes, sometimes I think Michigan needs to post a sign that says, help wanted. Help wanted in Michigan, because we have a lot of openings. They require some education, some skill, and you have to pass a drug test,
Yes. Yes.
okay? Otherwise, don't apply.
So
The
the
other
jobs
part,
are open.
the other part of that is they made welfare so easy and so convenient that,
That's
you
right.
know, you're
Yeah.
competing with welfare system for.
That's right.
Yeah.
It's free.
Yes, and the welfare system is not made to be lifelong. It's, you know, if you fall because you lose your job, it's to kind of support you for a short period of time. You know, so if someone loses their job, then they come to the department, they register that they lost their job, they then go to the next room the same day, and they take a test to find out where they are with their education and skill level. And then they go to the next room that says, okay, this is what you can do. We have these jobs you could do. You need to get a job. Here's where you need to go. You need to get that job. Again, you have to pass the drug test. People that are on drugs, they get injured. They don't work to full capacity. So businesses
But then they
Don't want
should
'em.
forfeit their welfare too.
Yeah.
Yeah, exactly.
Yes, yes. We're on the same page on that.
And they just tried to do that, and they said there was a law that you could not pair that up. I thought there was a law in Michigan.
Well, I'm just letting you know how I feel about it.
Jim, you got one more over there.
Yes.
Yeah, Carolyn, you had a,
Oh, my question was, would you pull people off of welfare if they could not pass a drug test? But you answered the question.
Okay.
Thank you. Yes.
Okay. Thank you, Jim. Is there any other questions?
I worked in medicine for 40 years myself. I'm not a physician, but I worked in the auto industry. And when you talk about drugs, not just drugs, if people using drugs endangering themselves, they endanger other employees and hurt other employees, which is a tragedy in itself. And I've seen it many, many times, and it's just a horrible situation. And, right, we should just, they're on welfare, pull them off of it. I'm going to be zero tolerance to drug users, if they don't want to help themselves, that is.
Thank you, Jim.
Okay, thank you all.
Nice to have you here. If you are ever in this area on the fourth Monday, you're more than welcome to.
Okay, okay. And if you want to have a town meeting, let me know, and I'll come.
Okay.
Will there be security?
he's our security.
I got security here.
He's security. He's sergeant at arms
Okay,
and
good.
he is strapping.
All right, good. Okay. All right, so connect with me on the web and on Facebook, and we'll come back whenever we can, whenever we have the invitation.
Well, I am very impressed that you came all the way out here. I appreciate it. Thank you so much.
You're welcome.
We all do, thank you.
You always have an open invitation.
Yes, Martha? Oh, no, we have to get back to Saginaw.
Drive safe, watch the
Thank
deer.
you.
You got my card.
Yes, I agree. Okay.